The loss of a child is always a profoundly painful and difficult event for any family. If death is anticipated, the family has the opportunity to think about how they want the child's last days to be spent. They can make decisions about resuscitation efforts and plan for spending time with the child and having time to say goodbye. They can plan for the funeral, even discussing this with the child, as appropriate. They are able to begin negotiating their way through the grief process. A decision to not resuscitate must be clearly communicated to the entire healthcare system, and a physician's order must be written to spell out the treatments that are to be withheld. When a child dies unexpectedly, of course, the family does not have the opportunity to begin an anticipatory grieving process. In either case, the family's progress through the grief process may be prolonged. Each child and family will cope with death and dying according to their own unique needs and strengths. Parental misconceptions and fears about death are often passed on to children. Treating death as a part of life is difficult, but it will help lessen the fear and confusion. When working with the family, it is important to respect their cultural beliefs and values as well. Each child, whatever the age, has an individually unique concept of death. Factors that most influence a child's understanding of death include past experiences with death, the child's age, cognitive and emotional development, nature of the illness, degree of pain, level of consciousness, and family attitudes and environment. Children are exposed to images of death via cartoons, movies, television, video games, and books. The child may have a personal experience with death from the loss of a family member, friend, or pet. It is the nurse's role to help the child express and cope with feelings and fears. An infant has no real concept of death, but will react to separation from parents, painful procedures, and changes in daily routine. An infant who has terminal illness needs as much physical and emotional care and has the same need for a comfortable environment as children in any other age group have. Maintaining a consistent routine is important for both the infant and the caregivers. Because infants cannot communicate their needs verbally, they often express fear by crying. Toddlers also have very little concept of death, but will respond to the anxiety and emotions of those around them. When parents and loved ones are sad, depressed, scared, or angry, the toddler can sense these emotions and become upset or afraid too. Ideas like death or forever or permanent do not have real value to children of this age group. The toddler does not understand the relationship between life and death. Death is not a permanent condition. At preschool age, children begin to understand that death is something that adults fear. Most children in this age group do not understand that everyone and every living thing will eventually die. They do not understand that dead things do not eat, sleep, or breathe. They may view death as temporary or reversible, as they see in cartoons. Because preschoolers are very concrete and literal thinkers, death should not be equated with sleep to prevent the possible development of a sleep disorder. The preschool-aged child may ask questions about why and how death occurs, and tends to feel that his thoughts or actions have caused the death and sadness of those around. This idea may make the preschool-aged sibling of a dying child feel as though he is to blame for the illness and death, resulting in feelings of guilt and shame. Young siblings of dying children need reassurance and comforting during this time period. The ill child may believe the serious illness is punishment for something he did or thought about, and find it difficult to understand how his parents could not have protected him from this illness. By school age, children are developing a more realistic understanding of death as permanent, universal, and inevitable. They are often very curious about the physical process of death and may have questions about what happens after a person dies. Fear of the unknown, uncertainty about what happens to them after they die, loss of control, and separation from family and friends are the main sources of anxiety and fear related to death for the school-aged child. The adolescent's concept of death is greatly influenced by past experiences, such as the death of a family member, friend, or pet, and by emotional development. Most adolescents fully understand that death is permanent, universal, and inevitable. Adolescents may be concerned about having religious or cultural rituals respected and observed. The adolescent is beginning to establish a sense of identity, independence, and relationship to his peer group, and a major premise in adolescence is the feeling of being exempt from death. Recognition of this reality of his own death threatens all these objectives. A teenager facing death may suddenly exhibit denial and defiant attitudes that are at odds with his normal personality. An adolescent may feel unable to communicate with parents and that he no longer fits in with his friends and peers. Adolescents are very concerned about self-image. A terminal illness, along with side effects of treatment, may cause unpleasant physical changes that the teenager must endure. The adolescent may feel scared, angry, and all alone in coping with illness and death. It's important to remember that children of all ages can respond to death in a unique way. Children need support, and in particular, someone who will listen to their thoughts and provide reassurance to alleviate their fears. There is no one right way or one right length of time in which to progress through the grief process. The grief process should not be thought as a linear process, but recognized as a cyclical process that each person negotiates in an individual way. While recognizing that the experience of grief is an individual experience, you will note some common reactions, symptoms, and behavior. Knowledge about the grief process and characteristic responses can help you provide emotional support for a grieving family. The focus of care for the dying child should be on pain relief and comfort measures. Plan procedures and assessments in a way that will provide uninterrupted rest and privacy. Set priorities according to the needs of the child and family. Probably the most important thing you can do at this time is simply to be available and willing to listen, sitting quietly with the child and family. Avoid offering unrealistic hope and placatory phrases like, "I know how you feel," or "at least your suffering will be over." Such comments are not helpful. Provide accurate and relevant information about the child's condition based on the family and child's questions. Provide as normal an environment as possible, with opportunities for play and other activities the child enjoys. Allow the child to do as much self-care as possible. Let her express feelings through therapeutic play and be available to listen. Spend time with the child when the family cannot be there, especially at night. Support the family's coping and decision-making processes. Encourage the family to identify and use formal and informal support resources.